Good afternoon. It is Monday, November 27th, 2023, 2 p.m. This is the Committee on Health and Homelessness for an informational briefing here in conference room 329 in the state capitol and via Zoom. Members of the committee, welcome. Good afternoon to those in the public with us. Also, good afternoon, and to those joining us remotely. Thank you for joining us. Today's informational briefing is an overview and report on the progress of Ohana zones created through Act 209 in 2018 and various amendments since then, as well as the supportive housing pilot program created this past legislative session via Act 95. We will have presenters from the Governor's statewide office on homelessness and housing solutions, as well as the director from the City and County of Honolulu, Director of Department of Community Services, that has been one of the county partners in the rolling out of Ohana zones and Ohana zones funding. Both of these programs are outgrowths of legislative pilot programs since 2018 to address the persistent problem of homelessness. So we'll jump right in. Members, we'd like to try to keep this to about 2 hours. So we're going to have opportunity to question our presenters both during and after the presentations. And our first presenter is Mr. James Koshiba, the Governor's Coordinator on Homelessness. Mr. Koshiba. Oh, yes, we do have our colleague, Representative Epsilon, in the audience, and it is, by tradition, Representative, you can also sit on our side of the table. Thank you for joining us.
I'll leave early, but I'll be here.
Ask questions early.
Perfectly fine. Go ahead, Mr. Koshiba. Thank you.
Thank you, Chair, Vice Chair, committee members, other representatives. My name is James Koshiba. I'm the Governor's Coordinator on Homelessness. In addition to the topics that Chair Bellotti said I'd be covering, Ohana zones and permanent supportive housing, I'll also be providing an update on the Kauhala initiative, which the legislature also funded this past legislative session. So those are the three topics I'll focus on. I thought I'd spend some time providing a little bit of background on myself, on the priorities, and that will provide context for where these resources and tools now fit in the overall strategy to reduce and end homelessness. As I mentioned, I'm the new coordinator of homelessness. I've been in this job since January. My background prior to that was entirely on the community and nonprofit side of things. And since 2015, my work has primarily been to learn with and from people on the street, people experiencing homelessness, to try to get a different perspective and different view on some of the solutions available to us, maybe to identify places where our existing systems and solutions aren't working well for folks on the street, and to bring some fresh perspective and ideas to the table. And I think that's the reason why Governor asked me to take this position. What I learned in 8 years of relationship building and listening and learning to folks on the street was that a lot of the things that I thought I knew about homelessness and its root causes were actually misperceptions and myths. And so I thought I'd start by sharing some of those with you because, again, they provide context for the priorities and the strategy. One persistent myth that, again, I believe myself was that many of our folks on the street today are not from Hawaii, that they're newcomers to the islands. The best available data that we have suggests that that is not, in fact, the case. We're really looking at a percentage of the homeless population that is 10% or less in terms of newcomers to the islands, people that have arrived just within the last 12 to 18 months. The vast majority of folks on the street are local residents that have been here 15 years or more. A second myth is that our folks are on the street because they are service resistant. They don't want help. This, I think, stems from anecdotes or even personal experiences with a homeless person who will be offered help by an outreach worker or by a program, and will turn it down and say, "That's okay. I don't need it. I don't want it." What I learned, again, through those relationships and spending time with folks was that is a response that is rooted not so much in the fact that people don't want help, but that they've given up on the ability of our system to actually deliver the help that's being promised. And first and foremost, the help that's being promised by outreach workers and shelter providers and such is that if you come and enroll in our program, if you come and enter the homeless services system, and allow us to assess you, then we will help you get housing at the end of this journey. But the reality is, as we all know, that housing is very scarce. And so people spend months or years in the homeless services system, cycling in and out of shelters, registering and re-registering for benefits or programs, engaging with outreach over and over again. And after several rounds of that, they've given up, no longer have faith that their participation in that system will lead to housing. And so it's not so much service resistance as it is just a loss of faith in the system to deliver that housing at the end. A third myth is that rising rates of mental illness and addiction are driving an increase in homelessness. They aren't. If you look at the trend lines on serious mental illness and substance use disorder in Hawaii over the past 2 decades, they have not increased dramatically. What has increased dramatically is the gap between housing costs and what people are able to earn. So that's not to say that mental illness and substance use are not contributing factors to homelessness, but really what's driven the increase is this dramatic spike in housing prices that began around 2005 and have outpaced wages. And what that means is if you have an addiction or you have a disability of some kind, you're no longer able to sustain your housing or find housing anymore because the housing market is so competitive now, and landlords have better options than you if you're bringing any kind of difficulty as a tenant to the table that people aren't able to find or sustain housing anymore. And the final myth is that services and shelter by itself will end homelessness. We absolutely need services and shelter. In fact, we need more than we currently have, but that alone is not going to end homelessness because really what we need to end homelessness is homes at the end of that journey. Temporary spaces, transitional spaces. There's no place for people to transition into after them, right? Which is why we have this repeated cycling in and out of temporary and transitional spaces. And this lays the groundwork then for, I'm going to skip past some of these root causes and go straight into the challenges and really the priorities. So the scale of the challenge in front of us is approximately, as of the last point in time count this past year, about 6,500 people who are homeless. That is almost certainly an undercount because not everybody is caught during the one-time census, the once-a-year census, but it's the best estimate that we have. And a majority of those folks, almost 4,200 of the 6,500, are unsheltered, which means they're not in emergency shelters, they're not in transitional housing, they're not couch surfing, they're the folks on our sidewalks and beaches and parks. And that is really where our office intends to focus a lot of our time and investment and energy, is moving people from street to home quickly. Our goal is to cut unsheltered homelessness in half in the next 3 years. That would mean bringing 2,000 people home from the streets and doing it expediently. 2 footnotes I would add to that goal. One is that we'd like those gains to be proportional across the islands. So we'd like to see them distributed equally across jurisdictions. And the second is that we are facing into some pretty serious headwinds in this effort. One, of course, is that housing costs continue to climb, and there isn't an end in sight to that. And the second is that many of the COVID era funds, federal funds that were available to help people get housing or retain housing, are now not available for the first time starting this year. And so there will be a drop in resources available, but thankfully the legislature has appropriated funds that provide us with new tools to help achieve this goal. So the 5 priorities that we think will help get us to this goal of cutting unsheltered homelessness in half in the next 3 years are these 5. And the first 3 are all about creating that long-term space for folks that, as I mentioned, has been one of the missing pieces in this puzzle. Because we haven't had that space, people have been cycling in and out of these temporary spaces. But the first 3 of the 5 priorities are all about creating this long-term space. Priority number 1 is to create deeply affordable, and I'll come back to that term, deeply affordable space, long-term home for people using the conventional housing models and tools available to us. You know that we have housing subsidies, we have tax incentives to help develop affordable housing, we have some existing models of creating and supporting people in affordable housing, such as permanent supportive housing. We want to make sure that all those tools are targeted to, and at least a portion of those resources are accessible to people experiencing homelessness. Right now, for example, our primary tax incentive for creating affordable housing is the low-income housing, the federal low-income housing tax credit. And we have state rental housing revolving fund monies that are often paired with those funds to create projects. In the vast majority of cases, those projects are not serving people coming directly off the street. They're simply not affordable enough. So we want to make sure a portion of those resources, those conventional housing, affordable housing resources, are targeted to and accessible to folks coming off the street. That's priority number one. Priority number two is, even if we can do that, we still need to experiment with new models of creating and sustaining deeply affordable housing in perpetuity. And this is where the Kauhale initiative comes in. The big challenge with sustaining conventional affordable housing is it's very expensive to build and it's very expensive to operate, right? So government ends up subsidizing the development of this housing. And then even to allow it to stay affordable to people, we end up also having to subsidize the rents. We're giving people vouchers to be able to afford the affordable housing that we've built, okay? So under the Kauhale model, we're trying to experiment with a different model of housing, community housing or communal housing, that brings both development costs down and operating costs down. And both of those savings will come from building a sense of community and communal responsibility among residents. The intention for these spaces is not to have to depend in perpetuity on long-term subsidies for operations or rental assistance, and not to have to depend long-term on supportive services either. That the healing and support that people need will come from building community. I'll come back to this, but that's the second priority. The third priority is we definitely still need spaces with clinical supports, very specialized supports for people with serious mental illness and deep substance use disorder challenges. We don't have enough of those spaces, and they range from everything from inpatient hospital beds to community-based spaces, recovery homes and group homes. We don't have those kind of spaces for people either. We need to expand those. If we can make good on priorities 1 through 3 and make space for people, create space for people to come home to at the end of this journey, then we need to really zero in on priority number 4 and make sure there are no obstacles or bottlenecks or hurdles along this pathway from street outreach to housing placement. Right now, there are too many bottlenecks. There's too many hurdles in the process. This is part of the reason why people spend months or years trying to get into housing, even if they're determined to do so. It's not easy to get your vital documents replaced. It's not easy to qualify and requalify and maintain your eligibility. We need to make sure that's a smooth path home for folks. So that's priority number 4. And the fifth and final priority is all of this is going to require us to change the narrative around homelessness. Right now, the predominant, you know this as well as I do, because our office is where many of the complaints about homelessness get funneled to. But you know that many of those contact points with constituents are people saying, just get these homeless people out of the park in my neighborhood, or off the sidewalk in front of my storefront, or off of the street corner by my neighborhood school, because this person is a problem. They're a nuisance. They seem dangerous. They seem like they're attracting criminal activity. They seem like they're not in their right mind. And I don't care where they go next. I just don't want them in my neighborhood. We have to call all of us, myself included, away from that knee-jerk reaction to homelessness and back toward a more communal sense of responsibility and a recognition that it's going to take each of us to actually solve this, away from the NIMBYism, the not in my backyard, and toward a yes in my backyard, or at least where in my backyard. If we don't want folks in the park, where in our neighborhood is there space for the deeply affordable housing or the group home or the treatment facility? Because if we don't want that either, if we're also going to be NIMBYs about those facilities, we're never going to solve this. And so our message has been, we can't stop at NIMBYism. If you're about NIMBYism, then we're basically throwing up our hands and saying we're going to live with homelessness. We need every community's support to find spaces to bring people home to. Those are the 5 priorities. When I say deeply affordable, I mean units that can be rented for about $500 a month or less. And the reason that price point is important is because many people on the street today have a source of income. It might just be general assistance or a disability check. It might be a cash job or minimum wage shift work. they can afford something in this price range. Anything above that, and they can't. And this is the reason, the fundamental reason on the street is we don't have anything in this price range in our housing market today. I'm going to skip past going a little bit more in-depth into Kauhale. I can answer questions about the Kauhale concept and just dive right into where the resources are right now in the interest of time. So the legislature this past session appropriated funds for the Kauhale initiative. As I mentioned, this is community housing. It's often envisioned as tiny homes with shared bathrooms and kitchens, but it doesn't have to be that. A Kauhale could be created in a repurposed apartment building, a dormitory, a vacant office space. But the key defining features of Kauhale are, one, again, that we're trying to demonstrate more affordable models of creating units of housing and operating units of housing. And number two, that affordability comes from building a sense of community and communal responsibility among the residents who live there. So we want to encourage residents to start taking on responsibility for things like security, for groundskeeping, for maintenance, even for being peer supports and peer specialists on how to navigate the systems we have for other residents in their building or in their Kauhale. And that will mean less money spent on things like security and supportive services and groundskeeping and maintenance. And those savings can be passed on to people in the form of sustained, deeply affordable rents. Okay, so that's the model we're trying to demonstrate. The legislature appropriated $15 million this fiscal year and $33 million next fiscal year to demonstrate the effectiveness of Kauhale. Our goal for this year is, our goal for this term is to have a minimum of 12 Kauhale villages established across the islands, 6 on Oahu, 2 in each neighbor island county. We'd like the combination of those Kauhale to house approximately 1,000 people, to bring 1,000 people home from the street. And again, we want to demonstrate that operating costs can come down over time and be controlled over time by fostering this sense of shared kuleana. You have in your materials a listing of the potential Kauhale sites that have been identified. The biggest challenge, so these funds were appropriated as of May. They became available for the administration's use in June. And since June, aside from August and September, which were devoted almost entirely to Maui, our office has been on the hunt for viable sites and viable community partners, organizations that can operate these spaces effectively. And those have been the two biggest challenges out of the gate in creating viable Kauhale projects. On the physical site side, we need to analyze each site first to make sure that there is actually access to infrastructure, water, sewer, electrical, and transportation that's adequate for use as a Kauhale. We also need to make sure that there are no issues with a potential property that would prevent its use or development as a Kauhale site. This could include flooding issues, hazardous materials, or known issues with the topography or geotechnical issues on the site. So that's part of the analysis that goes into identifying a viable Kauhale site. And then the very next thing is identifying a viable community partner to help operate that space. So the sites listed on the top half of the sheet are projects that have sites that have progressed 90% of the way through the site analysis, and we're confident that they're viable physically as sites, and where we feel confident that we have or can quickly identify community partners to help us operate those spaces. The ones below, under pending further talks, are projects where that analysis or those conversations are ongoing, and one or more of them still needs to be worked out. Typically, it's an issue with the land and the site that we still need to address. But these, as you can see, they run the gamut in terms of locations and scale, in terms of the number of people they will accommodate. And we are on our way to identifying viable sites that will get us to that 12 Kauhale minimum and 1,000 person goal. At the bottom of this sheet, you'll see a placeholder for community-based proposals. That's because we are also inviting communities and community-based organizations to submit kauhale proposals to us. We'll be issuing that solicitation in January and expect to have proposals in by March with selections of projects shortly thereafter. And this is where we're on the hunt for community organizations, whether they're churches or other faith-based groups, nonprofit organizations, in some cases private landowners that have said, I'm willing to donate or lease a portion of my property for a kauhale. I have a partner, a church that's willing to work with me. How do I make this happen? We want to make some of these kauhale resources available for these community-based proposals as well. Moving ahead to the second of the three programs, the Ohana Zone pilot program. Chair Bellotti already mentioned that this was created by the legislature in 2018. I have just excerpted a few highlights from that initial authorizing legislation. It was intended to try something new. It was intended to create safe spaces that were havens for people and where folks, both staff and clients, would treat each other as extended family, hence the Ohana Zone title. And it provided flexibility, particularly from development regulation and from procurement regulation, so that the funds could be distributed quickly. And if something new had to be built, we wouldn't have to wait for and wade through the typical regulatory process for development. Now, my understanding and my sense, having been in on some of these 2018 hearings as a testifier, is that this was actually intended to be sort of a safe zone program. And the challenge that came up immediately was that there was no zone for safe zones, and that most communities and the county governments as well didn't want to establish safe zones in parks or in other public spaces. So there just was no space for safe zones. So what happened instead was, with the first appropriation, the funds were used to fund a variety of programs, everything from repairing shelter roofs to paying for transitional housing to law enforcement assisted diversion programs. So it was a wide range of projects and programs from 2018 all the way up to 2022, which was, well, the legislature made a small appropriation in 2019. It was $15 million in 2018, another $2 million in 2019. Those funds were what was put into a variety of programs over the course of the next several years. The next Ohana Zone appropriation by the legislature was in 2022. Those funds, instead of going to a variety of programs and agencies, went to the counties. They were subcontracted by my office, my predecessor, to the counties, and the counties selected projects that they thought would serve gaps and unmet needs in their local communities. And what ended up happening over the course of 2022 and 2023 was the county started to use these funds more and more to launch supportive housing projects, actually, for the most part. Some of them did it through vouchers. Others did it using Ohana Zone funds for a combination of capital improvement projects and operating subsidies. But most counties, and in most cases, used it to launch supportive housing for two reasons. One is they recognized it as a gap that needed to be filled. They saw this need for long-term space as well. And the second was they saw it as a less restrictive pool of funding that they could use to quickly create these spaces and quickly get people into spaces, and particularly that they could avoid some of the restrictions that come along with HUD funding, Federal Housing and Urban Development funding, and funding that tends to follow HUD regulations. So down below here, you'll see 3 examples of that flexibility. You'll see that under the Ohana Zones FY23-24, $15 million. Now that my office and my team have responsibility for distributing these funds, our plan is to refocus Ohana Zones on projects that provide startup or demonstration money for projects or programs that will lead to sustained housing placements, including supportive housing. We're going to continue to do it through the counties because they've been good partners in this throughout the last 1.5 to 2 years. And we want to make sure that any projects or programs that are funded also make maximum use of the flexibility that Ohana Zone funds provide. And there's 3 examples here. One is that we want to be sure that it's not limited to people that fit the definition of chronic homelessness. You probably heard me testify on the restrictive definition of chronic homelessness last session, and the fact that you have to document for yourself that you've been homeless continuously for a year or 3 times, I forget in the past so many months, and also that you have a disabling condition that can be diagnosed as a disability. And so many people struggle to provide this documentation or maintain it on the street, and therefore fall out of their status as chronically homeless, and then cannot qualify for many of the resources and housing available through other funding sources. So we want to make sure that Ohana zones are filling that gap. We also want to be sure that it provides quick pathways home. So some of the counties in the supportive housing programs that they've started have said, you don't need to come through the coordinated entry system in order to enter this housing. Part of the reason for that is that coordinated entry, while it is important, and I think adds value to our system, it can also be very cumbersome in cases. And the reality right now is that only a fraction of the people on the street, of our people on the street, are even in the homeless management information system right now. It's about 60% on Oahu of folks on the street that are encountered during the point in time count are in our homeless management information system and could therefore qualify through CES. On the neighbor islands, it's lower. It's between 30 and 40% of people who are actually in the system. And so we'd be excluding a large portion of folks if we make them come through coordinated entry first. So that's a second flexibility. And the third flexibility is that HUD has its own standards where it qualifies as suitable housing. That does not include tiny homes with shared bathrooms or shared kitchens. So some of the spaces that we're creating would not qualify under HUD definitions. Ohana zones can be used to support those projects as well. Okay. So that's where our intention is to use this latest appropriation of $15 million of Ohana zone funds. And we're already in discussions with the counties about projects and programs that they intend to fund through it. The final of the 3 tools that the legislature equipped our office with is the Permanent Supportive Housing Pilot Program. This was the initial draft of the legislation included capital improvement funds, contracting funds for supportive services, and rental subsidies, all intended to be used in a physical project, like a building. And so project-based permanent supportive housing versus what we have today mostly, especially on Oahu, at least on the state-funded side, is what they call scattered site supportive housing, where a person will get a voucher and a case manager, and wherever they find a unit, that rental assistance and support services will follow them. But we're talking about getting a building or a project where everybody that lives there is provided with these supportive services and the rental assistance together. So you can see the amounts there. My office is responsible for contracting for the supportive services. HPHA is responsible for administering the rental assistance funds. And because the intent of the legislation is to support affordable permanent housing services for people with special needs, this could be a disability, it could be kupuna, it could be someone with need for mental or behavioral health supports, or it could be someone that's transitioning out of homelessness and needs case management and some support adjusting to their new housing situation. But because the intent is for it to be permanent supportive housing, we're trying to stretch these funds out over longer term contracts, so 5 or 10-year contracts for services and rental assistance to ensure that we can keep people in place, and then use that last pot of funds for the evaluation and data collection system to gather the data that shows the cost savings that this is resulting in terms of fewer visits to the hospital and the ER, fewer touch points and involvement with the criminal justice system. Permanent supportive housing evaluations across the country have consistently demonstrated the savings to government that permanent supportive housing provides. So we want to gather that data to prove the local case for that as well. So just a couple of quick updates on that. Because the final version of legislation did not include capital improvement funds, we're now looking for projects, programs, operators that have a building already, because we don't have funds to acquire or lease property. So we're looking for existing properties where a services contract and rental subsidies can create these permanent supportive housing projects for these populations who need those supportive services. Another part of the legislation said that the intent of the legislature was that these funds would be matched by contributions or billing of Medicaid. And so our office has been working with the MedQuest division of the Department of Human Services to ensure that we're incorporating language into our contracts for services that require services providers to build their capacity to bill and then bill Medicaid for any support services that are eligible under Medicaid coverage. That's taken some work because one of the requirements of Medicaid is that it not replace state funds and that it not reduce the state's effort in any way. So you've had to work out the specifics of that, but that language is being drafted into contracts now. And then the final piece is coordinating with HPHA on the rental assistance. So we're on the hunt for projects right now. We have identified properties actually where this can benefit and provide the permanent supportive housing that was the intent of the legislature. And I'm confident that we'll have selected a project. This is also exempt from procurement under the legislation. So we intend to sole source it, but to do our due diligence first and to find a variety of prospective projects before we contract. So in the interest of time, I'll skip over the rest of it and happy to answer any questions the committee has.
Okay, members, looking at time, it's 2:33, so we have some time for questions before we bring on the next speaker. Any questions right out of hand? Or we can break these up because I do think I have some questions. Go ahead, Representative Kobayashi.
Give us a high and low estimate for what you might want for both items, Kauhale's and supportive housing over the next couple of years.
So for Kauhale, I don't intend to come in this session for any additional funding. I'm squarely focused on expending the funds the legislature's appropriated over the next 2 fiscal years and demonstrating its effectiveness first. For permanent supportive housing, I do think it'll take a couple of years to demonstrate the effectiveness. But I'm confident that the need is there. And, I had testified in favor of and advocated for the original version of the bill, which had large appropriations for capital improvement funds, for the supportive services contracts, and for the rental assistance. I think it was between $30 and $50 million, depending on the version of the bill. The administration is not introducing a permanent supportive housing bill along those lines this year, but I would certainly support additional investment in permanent supportive housing because, as I said, although we want to make the local case for it, this is a proven model across the country, and it does.
The low estimate would be $30 million per year, and that's for both CIP as well as wraparound services. The high estimate would be $50 million.
Well, let me take more time with that. As I said, I personally, the administration is not planning on coming in with a permanent supportive housing request, but let me take some time to consider, what a low and high estimate would be for each of those categories, and get back to you with some thinking on that.
I just want to get an idea of the size of the ballpark.
Yeah. Well, here's one way to think about it. If we can get 1,000 people home with Kauhale funds, with a dozen or more Kauhale over the course of the next 3 years, in order to reach that goal of cutting unsheltered homelessness in half in that same duration, we'd have to make homes for another 1,000 people. Okay. The amount that's been appropriated now by the legislature, which is $2.75 million for services and $1.75 million for rental assistance, assuming we don't need to build or buy space for people. That's enough to get us about 30 units for 10 years.
Thank you.
Vice Chair? Okay, I just want to give Mr. Kraki, I think I'm going to have some questioning about 10 to 15 minutes, so Mr. Kraki will probably have you on about 2:50, just so for timing purposes. There's a lot of information, Mr.
know.
Kushiba, and it actually spans over various legislative sessions, so I thank you for kind of really breaking this out. Let's start first with Ohana zones. And I appreciate how you've teased out that it's been over 2 or 3 legislative cycles, and how initially the counties were not open to just having safe zones. And so then they moved towards more permanent supportive housing. So when you look at all of the appropriations that have gone to Ohana zones in the 2018, 2019 period, that money was essentially used probably mostly for services then, right? Is that an accurate representation?
I think a combination of services and housing.
So those service providers who are contracted either via the state office or counties really was just kind of maintaining homelessness, outreach programs, some initial transitional shelters, possibly transitional temporary housing. Is that also an accurate kind of representation of what those monies were
I
used
would
for?
say some of it was used for that, and I can give you the actual breakdown of the specific projects that it funded and programs that it funded. But I would say, just based on my recollection, it was about half things that sustained existing shelters, programs, services, and things that were new to the table. So it did demonstrate some new approaches as well, even with that first appropriation. And law enforcement assisted diversion was one example of that. That was, tried in multiple counties, and Ohana zones were used to fund that.
Okay, since you pick up on that, and I'm very interested because it looks like from the data that I have that law enforcement assisted lead programs were basically one and done. They were training programs and maybe some demonstration where service providers went out with law enforcement and they demonstrated that it could be done.
They did, and it lasted actually for several years. So one other thing about past Ohana zone appropriations is that they were contracted over the course of several years. So one appropriation might fund a contract, a 3-year contract for lead or for housing placement or housing services.
Okay, so one of the things I'm interested in, right, is that we're consistently always asked to have funding for these types of services or training programs. To what degree did you see counties adopting these practices and then funding it for themselves? Because at the end of the day, that helps and should help their management of their resources. Did you see counties doing that on their own and bringing it in-house to themselves?
In some cases, I think it's fair to say it's been a mixed bag. And to be honest, I didn't investigate each of the programs because it was such a wide range. I didn't investigate to see whether counties then adopted or picked up where Ohana zones left off. But I will say, in terms of supportive housing in particular, the counties have put in resources, if not to completely assume the cost that Ohana zones is providing, at least to complement it. So Kauai County, Hawaii County, those two in particular, I think, invested significant resources, Honolulu County as well, into housing programs that continued the work that was demonstrated through those initial Ohana zone appropriations.
Okay. And I guess one of the things I'm getting to with these questions, right, is as these programs get picked up, as supportive housing was seen to be the thing that was the fix, and counties stepped up and either paid for it or used contracted monies to pay for the supportive housing services. Do we know what kind of breakdown that was? Because I think that helps us with the appropriation question.
Yeah, unfortunately, I don't know that off the top of my head. It would take some pretty serious digging to get that, and I can give you whatever I have. One other thing I would add, though, is that every conversation I've had with the counties in the last 10 months, number one, has been very collaborative. I'm confident that we've built really solid working relationships with the counties now. And number two, I've stressed to the counties the importance of whether it's the permanent supportive housing funds or Ohana Zone funds, if it's going to fund projects that make use of county resources or require county partnership, then part of the onus on all of us, state and counties, state administration and county administrations, is to then make the case to our respective legislative bodies on why this is a good investment for the long term, county councils and state legislatures, right? And so that's been part of the conversation about Ohana zones that I've had this year with each of the counties.
Okay.
Sorry, one other thing I would add is that many of the things that are now being demonstrated through Ohana zones, especially since it's taken a turn towards supportive housing, and the permanent supportive housing pilot, right, can now be also covered by Medicaid funds. And so I think part of my task, our office's task, and this is a shared task with counties and service providers, is to build the capacity of the service providers who are currently providing these services with these funds to begin billing Medicaid and therefore reducing the dependence on the state appropriations for these funds.
Okay. I think thank you for bringing that up, and I think that's a really important piece, because through all of this, I think in our last informational briefing, one of the things we heard is the importance of braiding and blending resources. That's all a part of this, right? Everyone has to start to move towards ensuring they have the systems in place so that they can utilize the funds at all different levels and not just game the system, because we want Medicaid to be the first billing, if that's appropriate, and then we fill in wherever there is the gap. So I think that's a really important initiative as part of that. I think building on that, so you said in the Ohana Zone's funding and the new focus to make sure that Ohana Zone funding fills gaps for those who may not be entering the coordinated entry system. And then you have a appropriation here for a data collection system for the permanent supportive housing. Are you going to be running the data collection system for the permanent supportive housing pilot program?
Yeah, that's through my office.
Okay, how do you capture those folks, going back to the Ohana Zone's funding, who aren't coming in through the coordinated entry system?
Yeah. So what we can do, what we've been exploring with the counties and with service providers who have benefited from Ohana Zone's funding in the past, is a requirement that as people come into a program, they are then entered into, at minimum, into HMIS. So we're capturing their data, and we'll be able to track where they go from there. They just won't have to come through the coordinated entry process in order to get into the housing.
And then, so I'm always leery of us building new data collection systems. What is the vision for this permanent supportive housing data collection system? And then will it intersect with either with the CES?
Short answer is it will definitely intersect, and it's a work in progress. One of the challenges of permanent supportive housing as a concept is that it's really broad enough to serve a bunch of subpopulations, including folks that are not homeless, right? This could be people with developmental disabilities. I've talked to stakeholders who helped support the initial bill, who were thinking of it as a way to provide housing for folks who run the gamut from aging out of foster care to folks with disabilities who have parents who've been their caregivers and who are now aging and who may find themselves in a precarious housing situation in the near future. So the net has been cast wide with the permanent supportive housing concept. I really think it'll depend on who we select as that first service provider, this first kind of demonstration project. And I think we want to start with a subpopulation that allows us to design a data collection system that'll work for these other subpopulations as well. I don't know exactly what that looks like yet,
Okay.
to be honest.
Well, let's stick with this since we're here
Okay.
for permanent supportive housing. In the bill, there is a requirement that HPH has to be at the table. What's the engagement of HPH?
Yeah, so I've been talking to Hakeem and HPHA just about coordinating the provision of rental assistance, synchronizing it with the services contracts to make sure they're of similar duration so that folks don't run out of one or the other, sooner.
Okay. Are they actively engaged? And this is for them to administer 1.74 million up to 20 years?
Up to 20.
Okay.
That's how the legislation was written.
That doesn't seem like a lot at all for 20 years.
No, it's not. No.
That's for 20 years,
Yeah.
not per year?
No, that's for 20 years.
And how,
So what we're looking at right now is a project that can house approximately 30 people. And I think also written in the legislation was the intent that even the supportive services funds average $800 a month per person. And so the combination of that plus a shallow rental subsidy, we think we can stretch out over 10 years. So 10 years of supportive housing for 30 units. It could also be 60 units for 5 years. But I want to be sure the duration is long enough to actually provide folks stability and a sense of permanency, and for us to demonstrate the benefits of that stability and permanency for folks.
okay, the project-based rent assistance of 1.74 million is in addition to whatever else these individuals may qualify under other programs.
Correct,
So,
correct.
So that's how it's an additional rental subsidy. Would that mean that HPH might have some programs on the table for this purpose?
They could. I haven't talked to them about that, but they could.
Okay, I think we probably need some more further updates. And then is there a timeline for when you folks are supposed to have something presented more formally to the legislature for the permanent supportive housing pilot?
Not that I'm aware of. Oh, actually, yes. I think it's written into the legislation. Was it 2025 or 2026? We report back with the results of the pilot. I think that's the only date written into the legislation.
Dude, I thought we had something for you on December 1st. There was supposed to be a report back on December 1st.
I don't think so. I can double check, but
Okay.
I remember I testified and asked for time to demonstrate first before we reported back.
I
But
think we might have wanted a progress report
oh,
the
okay,
purposes of that, but we'll look that up.
okay.
Okay, any questions on this, members, on permanent supportive housing pilot? Okay. Can we move to the slide and maybe if someone could bring it back up? The slide on the running list of potential Kahale projects? Slide number 9. Page 9. Sorry. As we're getting that, and hopefully we'll get that on the screen. So I really appreciate that we have this list and that we're starting to see actual, viable sites and operators. I think, and I appreciate also that you wanted to make sure that it's spanning across islands and counties. How far, okay, let's go with the basic question. The total numbers, are these beds or people, or what are these numbers
Yeah,
reflective of?
they're beds.
Okay.
They're people, really. The number of people that can be accommodated.
Okay, so these are all new potential beds and people.
Yeah, there's only one project on here that has retained beds, and that's the Sacred Hearts Village in Pahoa. 32 beds retained and another 50 added.
And that was the Sacred Hearts Hope Services was what was just opened or celebrated on?
Yeah, their phase 2 just opened, and the
Okay.
50 is a phase 3
Okay,
that's in design.
Hope Services will be with us on Wednesday, so
Oh,
we'll get
great.
some updates on that. How far in progress are particularly the ones on the Hawaii State Hospital and the Iwilei Mental Health Kauhale? How far are we in moving towards those?
Yeah, so noted next to those is that it's Governor's Mental Health Chief Counsel, Dr. Michael Champion, who's been tasked with leading those projects. My understanding is that they're slated to be online by January.
And this is Kauhale projects in the Iwilei, one of them is in the Iwilei area. Maybe, we'll follow up with Dr. Champion on these. In terms of how soon these might, you commented that they're 90% done. Like, when do you think these contracts will be completed?
The site assessment is 90% done, and the reason I said 90% is there could still be something that comes up as we get to the nitty gritty of site planning, where we discover something on the site that could still render development infeasible. I mean, that's just the risk of the development process. Waikiki Vista is a partnership with the city and county. We expect that one to be online before the end of the year. Middle Street, we expect to be online by January. A Central Maui Kauhale to take the place of the temporary field shelter that's in Kahului right now. We expect to be online by next summer. And Mapuna Puna around the same time, summer or fall of next year.
Okay, I think seeing these sites makes this more real, and hopefully we can see some more progress as we get closer to January, especially on the ones that we've been hearing much about, but we don't, until we see it. No one sort of believes that it's happening. Thank you, Director Krucky, for being so patient. I actually think we're now at a good transition point to hear yours, because I think we're starting to get into that area of some of the things that you might be better positioned to answer questions on. I know that your presentation is going to be on some of the experience with Ohana Zones, the programs that I know that you're working really hard in the city and county of Honolulu to address homelessness. So I do want to invite your deputy director, Edward Laspanos, here, and I know Director Krucky, you're on Zoom. So members, if with your indulgence, we'll move on, and then we can answer questions of both Director Krucky and Mr. Koshiba at the end of this. Turning it over to you, Director Krucky.
Edward, go ahead.
Okay. Aloha, Chair Baladi, Vice Chair Takenouchi, members of the House Committee on Health and Homelessness. Edward Los Panos, Deputy Director, Department of Community Services. I'm joined online today by our Director, Anton Krucky, but on behalf of Mayor Rick Blangiardi, I want to thank the State Legislature for their support of the city homeless programs through the Ohana Zones. The funds that, as James highlighted, are flexible funds, so we do like to use them to help pilot certain projects that our HUD funding wouldn't necessarily provide. Similar to James, we also do want to highlight in our presentation today other programs that the city also funds and provides to kind of provide a complete picture of what's happening at the city and county of Honolulu along with your Ohana Zone funding. With that, I'll turn it over to Anton to do the presentation. I think I got to drive though.
Yeah, thank you, Edward. Chair Bellotti and members of the committee, thank you very much for allowing the city and county to be able to present to you. I'm Anton Krucky. I'm the Director, Department of Community Services. I have to say that before, one of the things we were asked was to kind of go through the use of Ohana Zone funding and going before. And I have to compliment the state of Hawaii because, we do a lot of the HUD funding processing in our department. And that being the case, it is limited to their view of the world. And there was a great acknowledgement by the state that there are programs that are needed that are more locally devised so that they can have a better impact, here in our islands. And that was the development of the pilot for Ohana Zone. And I hope that it can continue, maybe move out of a pilot stage, but I just want to commend you for that kind of foresight in going into that. On the second chart, I just wanted to talk about some history here. So I wanted to give you these charts so you'd have them for your background. But a lot of the funding has kind of been broken up into two areas to support HONU, which is our mobile operation, a triage shelter operation, and then the Housing First Increments 4, which we have multiple Housing First Increments in DCS. So these is a little over 10 million in 219 funding, and then now we currently have a little over 6 million funded towards us for those two programs. Next slide. So HONU, if you haven't visited it, it's a set of tents, and we can move it from site to site around the island. every 90 to 120 days. And we provide safety for people. If we are doing an activity on the island, we can offer a bed. It's 24/7 admittance. So it really helps the city and also in its purpose of cleaning up areas and the activities that we do. Next slide. Honu has been very successful. And we had to go through a period because we had the tents up in 2 sites before the pandemic hit. And then we kind of went into a piece where we had tents placed, a certain amount of distance from each other to adhere to the pandemic issues that we had. And now we slowly brought it back into its tents. And at the same time, Honu was run by HPD, and your funding went directly to HPD. And now we're transitioning out in the new funding into DCS. And we're now running that, and we're strategically looking at the best ways to run it going forward in today's world. But traditionally, Honu has been effective in over 50% of its cases, close to 60%. And when I say successful, that means either somebody that comes into Honu has been referred to a shelter, they've been referred to treatment, they've been relocated with their family, or we've helped them relocate to a neighbor island or back to the mainland. And so at a 50 to 58% consistent rate, considering the amount of individuals that we serve, and given the numbers that James gave you, the last one was 1,600 in shelters and 2,600 unsheltered. You can see those numbers are significant, that we're touching a very high percentage of the folks that are on the street that come through us. So we're very, very excited about the success that it has. I think the success is because the folks there are really trained to spend time with the individuals, to find out what their situation is, maybe help them with their documentation, partnering up with the service providers and bringing them in, their case managers, and kind of leveraging the whole system that we have to help these people move along in their journey. Next slide.
Anton, if I can add on this one, there's a typo on the bottom right-hand corner of this slide. The relocated, reunited with family or permanent housing number should be 380, not 3,380. There's a extra 3 on that number in the bottom right-hand corner of your slide there. But otherwise, if we didn't have Honu when the pandemic hit and the shelter capacities were slashed, we would have displaced a lot more people onto the streets just by shelter capacity. So city running that gave us the flexibility to kind of scale up and meet the needs during the pandemic.
Thank you, Edward. The next slide, just, you have to put people's face to the situation. And I think that, in all that we do, we have programs, and, my history really comes out of the business commercial environment. And so we do a lot of market segmentation. We break down markets and everything else. And I think that's very effective in this world. That being said, the solution comes down to one person at a time, 2 people at a time, what particularly works for them. And I think, I really have grown to know that we don't want to lose the model of the person's face in front of us that we're trying to help, and how that face changes from when we first saw them to when we help them solution, into a more permanent situation. Next slide. We are currently funding through a combination of fiscal recovery funds from the federal government ending in June of 2024 and state Ohana Zone funds end in July 2024. Our annual cost estimates for operations are $3 to $3.6 million, depending on the shelf life of the current equipment we have. We have some in the warehouse, and then we have much of it's in use. Next slide. So let me go back to the previous slide. I think I'd be remiss if I didn't say that, we're hoping, as we work with the legislature and through James's office, and James and I and Ed were in contact every week. We'd like to make sure that if we could see, continued Honu funding going forward, past the ending of July 2024 and continuing, I think you can see, because of the success of the program, how helpful it is. One of the concerns I always have is always wanting to move to new solutions. And if we leave old solutions behind, the new solutions have to do everything the old solution was doing before they get to zero. And so I just want to be mindful of that as we look at what we're trying to do. Thank you. Next slide. So the next part of the Ohana funds is the Housing First increment. And Housing First is is a name that was put out there really by the federal government that really says is if you can put somebody in permanent supportive housing, just place them there and surround them with services, you will solve homelessness. And I think that the housing first increment that the state does is a little more broad than that. It has those components to it, but it's a little more broad and it localizes some of the stuff we're doing. And so I thought I'd give you 5 programs that we're funding now, and you have the data there, whether it be Hale Maluahia or Kumuvai. What we do is the money that you get, we're placing vouchers in those programs so that we can house them and then service that housing. Next slide. And so continue, you can see the partnership with H3 and Catholic Charities and what we're trying to do there. And then their 10 vouchers. And then Hale Kipa, which they're trying to do. This one is they really do a good job because these youth are at a point in time in their lives where they're right at the, they can go either direction. And if they can capture these folks on a good direction, it changes lives. It's really incredible. The next slide. And then US Vets. And this is your program at Akamaoku that the state put the tiny homes project out there. And then the way we're supporting it is because operationally, the people that pay rent there can't pay enough rent to support the support that US Vets does. So your housing first increment comes to us. We then give the rent vouchers to the people staying there, and that allows US Vets to support them. So in this case, you're almost like the federal government Section 8 vouchers for this particular housing unit. Next slide. So here are some of the data for you on outcomes, the number of people being served. I think the important thing is over the last 3 years, the folks that we've served, we've had a 93% retention rate in housing. So we really are capturing these folks and being able to work with them. And, over time, a person that's been housed for 3 years with support is a much more stable person because over those 3 years, they built a little community around them. They know their neighbors. They know the people that they're working with, and the previous life on the street has started to fade behind them. And I think that that's very important because that transition from the street into housing is not a given. I mean, you would think that a person sits on the street says, "Oh, this is wonderful. I've been put in housing." Sometimes that transition is difficult. I meet many people that I see on the street where people say, "Hey, they're homeless." And I go, "No, that person's not homeless. They're housed, but they come back to the street to hang out with the people that they knew." So when you get this kind of retention rate, it really means that you're making progress. And I think that James talked about the point in time count, and homelessness is down, and we made a big push with CARES Act money in the city, and we ran a program called Oahu Housing Now. And in that program, we targeted people that HUD wasn't targeting. We did market segmentation, and we were looking to house people that wanted to be housed. A lot of them were single mothers with families, and if we could get them out of the system and off the street early, it saves us a lot of time and money down the line. Plus, you have to be there when one of those families gets housing. They were so afraid for just getting on. In that program, we housed over 300 families and 850 individuals, and that's why you see. A year ago, the time count was down, homelessness was down 17%. Now it was up 3% this past year, but given the fact that people are coming into the system and we lost a lot of shelter space over that time, it makes some sense. But also what that story tells you is that if we housed a lot of families off the system and the data shows that, we've also been very successful with the veteran population. What that's left us with are a lot of single males. And that has a higher proportion of drug use, open air drug use, and also mental health issues. And so when James was talking about some of his programs and working with mental health and supporting some of these other programs, I couldn't agree more. And we can talk near the end on some of the things we're not just collaborating on, but partnering on. I agree with him that in this arena, we need beds of many different flavors. Okay, so we still have some vouchers to go, but overall, we've been very efficient with the money that's come out in the Housing First Increment 4. Next slide. So here's our current spend down from the 2019 Ohana zones ending this June at the end of the fiscal year. and then we'll spend down the 223 zones ending June of 226. So, the annual cost is estimated to be about 1.5 million. And I'd like to be working with James, and we have been working with James on seeing how the run rate can go on. Again, I really want to stress that if we move on to new programs, which we will try to do because we need to be as creative as we can, we have to be careful not to sabotage other programs. I mean, we have to, but if we do, then we have to pick up all the benefit of those programs before a new one even has a positive effect.
Anton, before we move on
So
from
for
Housing First.
HONU, we're very hopeful. I'm sorry, yes?
Sorry, Anton, before we move on from Housing First Increment 4, I do want to highlight for the committee here that, what we did here was something different. We focused on 5 different populations, as you see in the 5 different programs. We also experimented by putting them in individual sites, kind of shifting towards the Kauhale model that James was talking about to kind of provide some data around that. Coincidentally, we did that with our programs. But we did use some of the flexibility that you have in some of these programs. So for example, with our domestic violence shelter, for example, we were able to put families larger than the unit size could hold under HUD housing quality standards. So if you had a 1-bedroom, you could maximum put 3 people in that. We put, a family of 4 or so, a mother and 3 kids in that unit, that we wouldn't have been able to do with that. When you look at housing shelters, shelters otherwise, family shelters, based on the last point in time count, people are spending on average in that congregate shelter, families, 270 to 312 days in a family shelter. So these kind of programs, these housing for shelters did help a lot, make an impact on our community. Thanks, Anton.
Thank you, Edward. So for future funding, we really would look for financial support for another 3-year term for HONU, and that would be from 2024 to 2027. And given the numbers I gave you before, it comes up to $9.6 million over those years. So switching now from Ohana Zone, what's the city and county up to in addition to the support that the state is offering us as we move forward? So in FY24, we had over $11 million funding support programs that provide support to chronically homeless and other homeless households. So one of the areas, in addition to that 11 million, we also got 2.6 million from congressionally directed dollars for an affordable house for abused women and children that will directly divert to the organization to buy a place for that. We also received 3.5 million for housing for persons with mental health. And I think that relates to the previous statements that were made, and we'll be working on that. And then we also have Kauhale projects, and we got 11.9 million to apply towards that. And we have one project that we hope will apply for these money up in Waianae, the Cedar Farms project. We're looking to fund another project in Waimanalo if we can do that. And then in addition, we'll parse that out, and hopefully some will help us with operations in those projects. Those do not include, those projects that I talked about do not include the partnerships that the city will be doing with the state on Kauhale projects. Next slide. So one of the main city strategies is CORE. And when I used to be the executive director of housing and homelessness, and this is where we came up with the idea of an alternative HPD response, and that's CORE. And we studied different programs across the country, and we worked on that in a way that said I put a committee together that had not only the city officials, but we had the state officials at our table at the same time, devising a city program. We had service providers, we had business leaders, and we also had 2 individuals that were homeless, so they could talk to us about what the world looks like when someone's approaching them. So, the response when we launched CORE was you have traditional police response, that's your 911. They come and they respond. We also have the community development teams that really, these policing teams they're working in the community. They're not just response for homelessness, but they're working in the high schools. They're working to help people along in trying to place people. But I would tell you, in getting to know all of them, they know most of the homeless in their territory by name, which is very helpful. And then we have the HONU program, which we've talked about. And then these are other diversion programs. But with CORE, what we wanted to do was when every city that we researched, what they did was they took the money and they outsourced it to a service provider. And especially as an organization like ours that does a lot of contracts with service providers, they only get their money if they do what's in the contract. So they won't do anything that's outside the contract. So we felt if we were going to develop a program like CORE, we'd make it a city-run department so that, or organization within a department, so that it could evolve as it moved along and try different things. Because if it was a service contract, they would only do the one thing that we could think of at the beginning and we wouldn't be able to evolve. So how's it evolved? Next slide. So CORE, when we launched it, they received $3 million in congressionally directed funds that they've been using. And then we launched it in the Honolulu Emergency Service Department. That's the department that has ambulance services and also ocean safety. And so, you know, they've been hiring up, bringing in vehicles, kind of leveraging the old ambulances and everything they could do. And they've tried different methods as they've gone. I think now they're up to over 30 people in the organization, right? And they've tried to respond both through calls where they're doing direct response to calls. They get stopped on the street. We also tried to do a piece where they did medical respite, right? We moved them out to the Evil Aid Resource Center for a little while, and they got their hand into that business, trying to see what's the right thing for them to do. And I think where they're moving now is they would like to get fully back in the street, but they have funding that could also cover the cost of medical respite in addition to their outreach. And what they want to do is they do want to manage a medical respite, and they're working with the state right now on the location and the funding. And then what they'll do is they'll contract that out to a service provider, and then they'll be able to cover the streets more. They can be a much better response to someone that's on the street, especially with their medical background, because, you know, if you're hurt and somebody treats you, and it may not be the first time, it may not be the second time, but after a while you get to know the individuals. And then when they say, hey, I got a bed for you, you may be at that place where you have the moment where you say, yeah, I'll go take that bed. Next slide. So as I said, we also have many Housing First initiatives in the Department of Community Services. These are mostly funded by the HUD programs that we have, and you can see them here. We have some with IHS, you know, a fairly large one. We have another one with US Vets. We have another one here with Catholic Charities. Next slide. And then the other ones we have the Holly Moliola, and you know that's a Cal Holly, and it's doing very well. It was originally the tanker cars, and it's come along well, and we're hoping that we have some very creative things coming up that will help us expand that. And then the Punahou Rest Stop, Mental Health Kukua runs that, and you know they have a lot of services there. People can get mail, they can wash up and everything else, and they keep a real low level outreach or case working there in case somebody wants to use it. There are many homeless that work every day. They can't afford a house. They come here, they shower, they go to work, they collect their mail, and they unfortunately go back and sleep on the street. We'd like to help those folks out, and again, beds of many flavors. Next slide. Okay, so we do a lot of outreach programs, and so with IHS, they have a very robust staff that includes psychiatric services, and they also have been in front of the legislature and in front of the judiciary trying to continue to expand assisted community treatment, which really, you know, you're trying to work with folks that have mental issues, and it's very hard for someone that has mental issues to make good decisions for themselves. And so, you know, the assisted community treatment kind of expands that decision making, and we continue to try to help those folks. And when we can make that happen, it makes a big difference. Landlord engagement program is very helpful. Like if we need beds of many flavors, landlords that will rent to us with vouchers are very important, but sometimes just a person paying their rent's not enough. They need, you know, the landlords have had a lot of experience, and some of these experiences aren't necessarily good. And so where we can incentivize the landlords to rent out their places using these vouchers, it's helpful. I mean, they have the benefit of, they know the rent's going to be paid, but you know, you have hard for people to get in with security deposits. You know, can we guarantee fixing the place up when a person leaves? Things like that can be very helpful. And outsource that program through our Partners in Care, which is the continuum of care organization. Next. We also offer, so that people can go to both the shelters and to HONU, we offer a 24/7 transportation program. Therefore, if somebody's on the street and we offer them shelter and they look at us and say yes, I'll take it, we can provide them transportation to the shelter. You know, the most shelters operate just during the day, what they call bankers hours, but HONU works 24/7, and this service is hugely helpful in that realm. Next slide. So the Department of Community Services has a lot of special needs housing around the island. We have, you wouldn't know they're there in communities per se, but we have a portfolio of over 60 properties. Some are can be used, for youth. Some are mental health. Some are houses for people, suffering from addiction and recovering. But on a smaller scale, and we give those properties out for almost no money to a service provider. They run the house, they run the program, and that's how their fees are. Across the island, we have over 2,000 units in play with these special needs housing. And like I said, they're all over the island. Most are in urban, where most of the needs are, but we have them all over the community. Next slide. So if I had to, summarize a very complex problem, homelessness is tremendously complex. The issues are complex. The people vary, and so how do you get your head and your mind around that? I really break it down into two areas. And what I would say is on the left of your screen is I want to do as many creative things that I can do to have someone that's on the street or in a shelter make a decision to engage the system. Anything creatively I can do to get them to make a decision to engage the system. And then the second part is what's on the right. I constantly am, in the department, is constantly analyzing the resources that we have to bear or that we could bring online to service those decisions. So, you have to make a shift. If, as an example, if we took a lot of families off the street like I described, and then what we're left with are treatment for single males, we have to make a shift so that our services and our resources match what could be the potential decision that what we could grab it at that time that would be made to service those decisions. But I would tell you, as many as decisions that are made to engage the system, there still aren't enough resources to service those decisions, and then we have a gap. And so we constantly are analyzing those things. Everything we can do to get somebody to make a decision to engage the system, and then what are the resources we have that can service those decisions. Next slide. So quickly in wrapping up, I have to tell you, since I was a homeless coordinator, if you want to call it that, in mirror to the state when I took the job of housing and homelessness, and then I took the job at community services, which really is the execution focus of homeless programs. And we had some different people in those pieces, but at the last homeless roundtable, not roundtable, but at the last homeless convention or meeting that was done statewide, the mayor announced that he was bringing that function into DCS. So I will also have the policy and deployment part and strategy part of homeless in DCS, along with the execution part. But over the 3 years, I kind of been doing that anyway for the last year. My deputy always says you've been moonlighting as a homeless coordinator for the city in the last couple of years. But that being said, I want to commend the state for the progress we've made, because when I came into that position, in 2021, the city asked me to work with the state, and the state and I said we got to create some working groups, and we evolved from working groups. And when I look at that chart in 2022, we moved from working groups into coordination. And then in 2023, we're going to move from coordination to partnership. So, partnerships are like this Evil A Resource Center, and I'll be glad to take some questions on it. That partnership is almost finished in ink. We're trying to finish up those documents. Waikiki Vista is a partnership that we're doing. We just awarded Hauula to the state, and that'll be another partnership we're doing. And the partnerships are generally where the city has land or buildings and such that it can convey and be used, and the state being able to deploy the programs in those buildings. but I commend everybody that I've worked with, from going to working groups to partnerships. Takes a lot of trust along the way, and I think everybody's lived up to that up to this point. So thank you very much for allowing us to present this as a base set of information, and we're open to address any questions you may have.
Members, that was a lot. Covering a lot. I have questions over a number of these slides, but I wanted to open it up first to you folks. Representative Kobayashi, if you have anything?
No, I'm impressed by 63 properties and considerable federal dollars. I didn't know.
Okay, well, let's kind of tease that out because I'm actually a little bit confused, Director, about some of this. And just so we're all kind of talking from the same things. The slides on the Housing First Increment 4 projects, you know what's getting
Yes.
confusing is terms are being thrown around about kahale that are interchangeable with kahale as we use it on the state side. We have, clearly you've blended lots of funding. Like, I think you're the model of blended funding at the moment because I see references to federal fiscal recovery funds, state Ohana zone funds, and what appears to be some city and county funding as well. So I just kind of want to tease this out because this will help us understand what our funding allocations and prioritizations have to be. So looking first at Housing First Increment 4, I think that's slide 7, 8, and 9. So as I understand it, these are Ohana Zone funded projects, and the Ohana Zone's monies are funding the vouchers, is that correct?
Correct.
Yes, that's correct. Edward, you want to chime in on that?
Yeah, sure. So there's 5 programs in our housing increment 4. Like I mentioned, we did kind of segment the market to try and do something focused on certain populations. We also focused many of these vouchers into a building on its own. One of the things I mentioned is that when you do a Housing First voucher, which is some of our Housing First increments 1, 2, and 3, which are city funded, we put them in scattered site wherever we can find a place, and we service them in that area. But if that person's making progress, chose to be housed, making progress, and they just have a bad day, they're having a meltdown, their neighbors only know to call HPD. And when HPD intervenes, it adds trauma to the process, and if it was a neighbor intervention, like in the Kauhale model, which James is kind of talking about, their neighbor knocks on the door and says, "Hey, Edward, you okay?" And they understand what Edward might be going through that day versus the neighbor, if it's a multifamily building, doesn't know what happens, they call HPD. HPD doesn't know what's happening either, no background, and it might end up in an arrest or incarceration or something down that path, which might set them back way farther back than if a neighbor or somebody with a shared experience might intervene, and their intervention is going to be a lot different. Yeah. So we did have a lot more success in these programs than our Housing First increments 1, 2, and 3, to be honest.
Okay, so here's a question then. For these Housing First projects in your Increment 4 program, is all of the funding going towards vouchers, or is there a service provider that's associated with these housing projects that are also getting funded through these programs?
It's a combination of service provider and voucher.
Okay. And the
There's a
And
wraparound
many
service.
times the vouchers are paying the service provider for being the landlord of the property.
okay. So for like Hale Maluhuia, who's the service provider attached to that?
DVAC.
DVAC.
Domestic Violence Action Center.
And Kumuvai would be Work Hawaii and Housing Solutions.
Correct.
Okay. So it's a combination of programs overhead and rental assistance / vouchers that are
Correct.
being funded. And this is Ohana zone funding.
Correct.
Okay. Now, if we move to, well, okay. So this is where you folks would need the additional funding, the continued funding from the state in the form of Ohana zone funds for permanent housing.
Correct. I mean, if not, those vouchers are currently being funded, those programs are currently being funded by the state. If we don't receive continued funding, it creates a cliff, yeah.
Okay. Now, some of this funding, it says you're using a combination of federal fiscal recovery funds and state Ohana Zone funds. Does the city have a plan to backfill the fiscal recovery funds, or are you folks looking at the state only?
So for the HONU program, that's where that's where we use the fiscal recovery
Okay.
funds to float that. As I mentioned, during the pandemic, we did have shelter capacities get slashed because of COVID restrictions, right? So we had to absorb some of that. So we did absorb that. We also doubled our HONU capacity. We went from 1 HONU to 2 HONUs in that regard in order to try and absorb more of that and make more of an impact in the community. So now we're back to 1 HONU. That's why when you look at the slide that has the kind of the longitudinal data on HONU, it looks like we slowed down some. That's because in that middle HPD section, we did kind of boost it up to 2. We also were taking folks from shelters that were displaced because of, restrictions around COVID restrictions. So that's probably the only blended program that we have. Going further out into our housing, in our city-funded programs, which was, I think, this slide here, the $11.3 million is strictly city general funds. Then we supplement some of that with with some congressional dollars. What's not included in that $11.3 million is our HUD money we get for Emergency Solutions Grant, home funding, as well as CDBG. I mean, that's not including that $11.3 million. So that's pure city general funded commitments where we're funding if you look at the slides that follow, Housing First Increment, other than core, sorry, this Housing First Increment 1, 2, 3, Hale Maoliola, Punawai, outreach navigation, landlord engagement, and this transportation program, that's the $11.3 million thereabouts. And that's every year.
And that's all city funded?
That's all city funded.
Okay.
So when James is talking about, does the city is the city and county of Honolulu, matching some effort? Yes, I mean, we have tremendous lift on our side. But we were kind of modeling after to try to funnel those things through the HUD programs using coordinated entry, using traditional models, yeah.
Okay, so since we're here, on the city-funded supportive programs, again, this is money that goes towards service providers who are contracted, and then a combination of both services that they provide and
Vouchers.
vouchers.
In the Housing First increments, yes. Punawai, when you get to like Punawai Rest Stop, I mean, then we're just providing basic hygiene services, clothes washing, shower services, things like that to the homeless population. I mean, health issues are a major thing in the houseless communities because they're living in areas that aren't made for habitation, yeah.
Okay. So those programs will continue to be funded, as far as you can tell, into the future based on continued city support of those programs?
Yes, I mean, they might morph over time. Like I said, we've learned a lot through the state Ohana Zone Increment 4, Ohana Zone Housing First Increment 4 program. As we get attrition to the programs, you might start doing, rather than having them replace the voucher, start doing things where you start moving them into individual buildings to kind of group them together so they don't have, they have better intervention strategy, better interventions. There's things like that where we're starting to analyze the data. Also during the pandemic, as James touched upon during his presentation, we also got a huge burst of federal funding that through the CARES Act, we had Emergency Solutions Grant C-CV funding, which is stood for coronavirus. I mean, we got 10 times more money to spend over a couple of years that we normally get in a single year out of that same HUD funding source that we were able to dedicate to programs. That was the Oahu Housing Now program that Anton mentioned, that we serviced over 300 families, over 850 individuals through that program. We did have those bursts. So when James talks about trying to cut down the unsheltered population in half in the next year, in the next few years, we did hit that cliff because those ESG CV funds are no longer available, yeah. CDBG CV funds no
I guess so.
longer available.
I haven't heard a satisfactory answer. How are you gonna backfill those funds, the federal funds?
So, primarily, we would like to see it coming from the state. If that's not an opportunity, would have to look into our general funds and see what kind of allocation we got on how we bear that. Anton mentioned that during the pandemic, not only did we lose shelter beds, we also lost shelter beds permanently. We lost major shelters with the Next Step Shelter, Family Assessment Center, as well as Lighthouse in Waipahu. So that's another reason why we're seeing a little bit slower HONU, because the throughput's not as bad, because there's not as many places that we had pre-pandemic to place people that went to HONU, that found HONU. We're having a hard time placing them out into a shelter bed. Program's still successful. We're still doing family reunifications and doing alternative means, including shelters. So,
Since we're on
Well,
HONU,
Representative, I think that's such an important question, and we ask ourselves that question often. I don't think there's a ready answer at this point, but we start to go through the budget process with the city council, and I'm sure that will be raised, and we're going to have to come up with some creative strategies on that. Right now, we publish an action plan with HUD, and so all of our actions stay static on that action plan once we publish it, and then once we make adjustments to it that we have to propose, it's sort of a 2 to 3 month public process to change the action plan for all those dollars that we have. But all these dollars that were thrown at public sector, everywhere around the country, I think everyone's asking that same question. I think it's an excellent question, and it's difficult. How do you find budget dollars to replace something that was given to you the way it was given?
okay, I think that's a question we're gonna have to continue to follow.
Sure.
But as a follow-up on that, I'm looking at your slide 4, and you keep saying that HPD picked up a lot of the kind of running of HONU during the pandemic, and that makes sense. But now that it's being phased out of HPD, who do you see doing that when it?
So DCS is currently the operator. We have staff dedicated to that. One of the things we ran into was just hiring issues at HPD. It's a public knowledge that we could use a lot more police officers in the force. So at that point, a decision was made by the administration to, hey, let's get these officers that are working on HONU, let's get them back onto the streets, into their patrol jobs, and out of HONU. Although HONU still relies heavily on police for security, as we migrate people from the street onto there, we do have people. We have instances where we have drugs trying to enter HONU, dealers throwing packets over the fence, and things like that, where HPD is a necessity to have at HONU. But that said, we did free up a lot of resources that HPD was committing to this program. DCS is currently running it. We've been staffing the HONU project since October.
And then when you say staffing it, so then you hire a service provider
We've been staffing this one directly. Similar to what Anton described with the core program, if you hire a contractor, you only get the 4 corners of your contract. By staffing it ourselves, we have the flexibility. If it needs to be this, then we can kind of pivot that without having to do a contract amendment, reprocuring the contract or anything like that. So it's been a growing process for us. Just seeing, people are brazen. We have people brazen enough to throw drugs over the fence. We do have people coming in trying to reclaim people for sex trafficking into the HONU. Anton mentioned, it's so critical for us is once person has made a decision to exit homelessness, that we support them as best as we can, or we create opportunities for them to engage. And HONU, being a mobile operation, meets them where they're at physically. If you're have a substance abuse problem and the person your supply is right near to you, how do we get that person there? They're definitely not going across the island to find that shelter. Yeah. Just to give them a
HMIS database would tell us that where you see the number where there's 1,441 that went to shelters, 50% of those people will go back to the street. And then 50% will go on to the system, stay in the shelters, another shelter, treatment, housing, or such. But it just happens to be the nature of the numbers.
Okay. I know Honu is receiving funds, Ohana Zone funds. I'm having problems with the terminology between Ohana zones, Kauhale. Kauhale is used by the state, Kauhale is used by the city. And I think some of the work we have to do over the next couple of months and when we head into session is tease out what each of these funding streams really are appropriating monies for and figure out how best to maybe allocate and reallocate so we can kind of make the system of funding more transparent. Because right now I think there's too much blending and braiding where it's not transparent. So I guess on that note, because this was in James's presentation, and this was Kauhale, and this looks like it's a partnership with the city and county, and maybe this is where the Kauhale is being actually used correctly, interchangeably between the two. Director Anton or Edward, could you expand upon the Ivole mental health Kauhale and maybe where that's at in process?
Yeah, I think that's probably mine to
Okay.
to answer. Edward and I have broken up these two projects. He owns Waikiki Vista and I own the Ivole Resource Center. So, the challenge with the Resource Center
Wait,
is
hold on,
that
Anton.
it's a multitude of different
Okay.
pieces.
Can I jump in with a clarifying?
Yes.
Yeah.
So that Ivile Kauhale is an actual village planned for Ivile. What Anton is talking about is the city-owned Ivile Resource Center, which is a building, an existing building that the city and the state, not my office, but the Department of Health, have been working together on to open up as both a triage center and housing upstairs.
Okay. And
They're-
that's
they're
your
separate
and that's your understanding too, Director.
Yeah, now with that clarification, we know which project James is talking about, referring to in his presentation.
Okay. So there's actually two projects coming up in Ivole area. Okay. And that's not something that anyone here can talk about now because it's still in development. The Ivole Mental Health Kauhale that was on your list.
That one is led by Dr. Michael Champion.
James, when you say that one, is that your project?
Yeah, it's a state project.
Yeah.
It's led by Dr. Michael Champion, Gov's lead counsel on mental health and the justice system.
Okay. And that's separate from the Ivole Resource Center.
Correct.
Okay, so maybe Anton, can you comment on the Ivole Resource Center project?
Sure, I'd be glad to. So that project has a combination of treatment areas, large rooms, smaller rooms, a mezzanine area that has some rooms that people can stay in and be treated. It also has 27 affordable housing units in it, and it also has a large commercial kitchen. And so right now, we've carved out the large commercial kitchen from the project that we're doing with the state. And the State Department of Health is going to work in that building. The state's we're going to go into a partnership with them. And you guys are going to do mental health treatment in both the downstairs and the mezzanine area. And then you're going to transition folks, whether it be from those treatment areas or from other places that the Department of Health is working with individuals, into the 27 affordable housing units upstairs. And so it's a combination of affordable housing and treatment centers. And, I expect that before the end of the year, there'll be a press release with the governor and the mayor announcing that to the public. In the meantime, the Department of Health and myself have been going around to the different neighborhood groups, advising them on what we're planning on doing, so they're kind of up to speed on the plan. So it won't be a surprise when we do the joint announcement.
Okay, and then you mentioned, Director Kraki, the Waikiki Vista. So that is the Waikiki Vista Kauhale project with the state and the city.
Yeah, I'll let Edward comment on that because he's been working directly with James on that.
So we've been working with James's office, the governor, to secure funding. So Waikiki Vista is a property we bought last October, I want to say. We continued the lease, the existing leases on there. Those recently went up going into the summer. It was a former dorm rooms used by HPU. while the city plans to put most of the building into affordable housing, as we intended when we acquired the building, we did cordon off about 4 floors, so 4 of the 9 floors that were used as dorm rooms for a vertical kauhale type project. We're looking at targeting families. As I mentioned, those families do spend in shelters roughly between 270 days to 312 days on average based on the last point in time count in a shelter, in a congregate shelter, to provide them a stable living space. And when I say they're dorm rooms, the dorm room sizes range from about just under 300 square feet to 420 square feet in the corner units on the dorm room. So they're not small dorm rooms, as much as there's something that we could kind of trigger and turn around really quickly. As one floor would be used more as a temporary shelter, if you will, for families exiting homelessness, and then they would graduate to the upper 3 floors of units and have a place to stay. I mean, we're not saying that studios and dorm rooms are ideal for families, but I mean they are sizable. I think at the peak of Waikiki Vista, when it was operating as Tokai University, I think they, even in the dorm rooms under 300 square feet, they're putting about four students in each dorm room. So,
The concept with this is then, if I'm understanding it correctly, it's one transitional, then moving the families to more kind of shorter term transitional, and then at that point you're also working with them to get them in more permanent housing outside of the 4 floors that you're talking about.
they can stay in the building, but I mean, yeah, if they want to transition out, because they are like a studio, right? It's an open floor plan of 420 square feet and the larger units. But if they do want, 1-2 bedroom type homes, then they can certainly pursue that.
And then these,
There's no time limit on those units.
okay, but these units don't have kitchens, or is it, when you say it's dormitory style, so is it common eating areas?
So each dorm room is equipped with a mini fridge and a heating element of some sort, microwave usually. So it does meet HUD basic housing quality standards and how we intend to operate as a affordable housing in the remaining 5 floors of the building. But yeah, part of the kauhale concept that we're going to follow from the state does include, a communal space for them to build community, for them to interact and build a community. So, so they are successful. That was a big element that, of the kauhale model that we believe in as well.
Okay. Well, I guess I appreciate that it's something that they'll be able to stay in for longer term. But if at the end of the day, as James said, the ultimate solution is actual more permanent housing, is the goal also to help these families with moving out beyond the kauhale type funding or kauhale type housing? And maybe that's for James to answer.
Yes, I can speak this. I guess I'd answer it in 2 ways. One is every kauhale is intended to be home for as long as people need it. In other words, what we don't want to do is impose artificial time limits to say you have to be out within 2 years, because our experience demonstrates that with the lack of housing afterwards, there's no place for people to move to. So we want this to be a home for as long as folks need it. At the same time, especially for Waikiki Vista, the city and county is working to select a service provider that's going to provide case management and supportive services to each of those households. And if their aspiration and their ability is to move to another housing setting that's more suitable long-term, they'll have that support from that service provider to do that.
Okay. So again, it's moving them along the spectrum of affordable housing,
It is,
but
provided,
without a hard stop.
yeah, provided that the housing is actually available, right?
Yeah, yeah. Well, so from our perspective, we're trying to do all of these things, right? We're funding more affordable housing development, and the whole idea is that the supply is going to be there at some point. I guess one last question, and I should look to my colleagues. Do you have any other questions? A few? Go ahead, Representative Kobayashi.
Just before this meeting, we came from a House Majority Policy meeting, and
You're stealing my question, I think, but that's okay.
One of the items that came up high on the priority was building of kauhalis. And I know that there's a variety of kauhalis, much less variety of locations. James, from your perspective, how much can we, how far can we push the Kahali system? That is, how much money, additional monies, might be usable statewide for Kahalis?
If your question is kind of the same question you were asking me about permanent supportive housing, kind of the range, I don't know the answer to that question. I want to take what's been appropriated so far and try to get 1,000 people home and keep people home. But
My thinking is that permanent supportive housing is so much more expensive than Kahalis per person that we frankly cannot buy ourselves out of this problem. And so, short term, I would see us trying to increase our Kahali space.
well, I think we need both, honestly. And actually,
Of course.
there's
But, I mean, we need the whole ladder, you know.
yeah, and actually, I would think of it in terms of subpopulations with different needs. So there's a segment of folks on the street, and in my opinion, it's a majority of folks on the street now, who can benefit from, who can find healing and growth and purpose just with community support, that building of community, support from peers, and at least initially some outside support from a service provider, but not continuing on in perpetuity. There's a big chunk of our folks on the street that can benefit from that model. There's also folks on the street who will need supportive services in the long run. Okay, those are folks who are aging, who have disabilities, physical or mental, or who have other challenges where the help of a service provider will be needed on an ongoing basis. That's where we need the permanent supportive housing. I think they're two different kind of segments of the homeless population, different scales, but right now I'm focused on demonstrating the need and benefit of both.
In terms of the HONU project, it seems to me that that is crucial to the success of getting homeless off the street. That is, it sounds like a successful entry portal. You're now down to one HONU. You had two. If you had additional monies for two HONUs, could you successfully push 50 to 60%, I think it was, of the people who enter HONU into other more permanent housing?
We've debated the second HONU concept quite a bit internally at the city. And, one of the things we kind of came down to was the lack of shelter space, right? Like I said, if we had more throughput, HONU's cost per person is rather high, only because it's a mobile operation. Our perimeter that we have to secure in a park setting is, a 360-degree perimeter. It is a lot more cheaper and more efficient in our experience on other data that we run, because we operate shelters too through a service provider. We subsidize those operations. It's a much cheaper operation to set up a new shelter than it is to set up a new HONU.
Oh, I didn't know.
I mean, so we had some internal discussions that, would we prefer a second HONU, or would we rather do a shelter, a brick and mortar shelter? One of the side concepts that has been really successful at HONU is it's been a good tool for combating NIMBYism. People kind of come in and, right now we kind of say it's only 90 days. It's only 90 to 120 days. It'll pass. Just let us experiment it. We have our complaints at first, but after a while they kind of say, hey, this is great. And so we've been able to penetrate neighborhoods and, what we might want to consider is opportunities to have smaller, shelters in other neighborhoods rather than just here in the urban core. One of the big successes of Honu has been meeting people where they're at, whether it's on the leeward coast, whether it's in town, whether it's in Kapolei, Waipahu area. It's just been lowering the barrier to enter shelter by bringing it to them. They can come for a day and they might decide this isn't for me and they might leave, or they might get curious down the road and come try again. Sorry, Anton.
No, that's good. I think that we've also modeled, because your question was very good, at a 50 to 60% movement rate, that's very desired. And we've also modeled where one Honu would move around. Maybe we buy a warehouse and create a Honu model there, maybe something urban, and then have one mobile Honu unit move around the island. So there's a couple of different ways to look at that. Thank you for that question. It was very good.
You know what, on that, no, go ahead.
Can I just add something here on Honu? And this is, let me start by saying that Anton, Edward, and I, our office and the city office have a very collaborative relationship, and there are many things that we agree on and projects that we're working on together. Honu is not one of them, and they know this. I've said this to them. And going back to what I shared about the plan for the current appropriation of Ohana Zone funds, I think the measure of success for anything that I'd like to put Ohana Zone money into is whether it results in an actual housing placement for folks. That 60% movement rate is through Honu in a matter of days and into other temporary shelters for the most part. So really we're talking about moving homelessness from one place to another and not reducing it or ending it. And so that's why I framed the priority for this round of Ohana Zones as programs and projects that will result in a lasting housing placement for folks, because that's what's actually going to move the needle on homelessness. So I just want to put that on the table. And again, this is stuff that Anton and Edward and I have talked about at length.
But if you're moving people off the streets through Honu to temporary housing, doesn't that count as some success? They're off the streets.
Temporarily, until they leave that temporary shelter and are back on the streets, which is what we have happening right now.
I see. They leave that temporary shelter, go back to the streets.
Yep.
They don't go onward.
So to me, the main benefit of Honu is you provide relief, temporary relief to neighborhoods who are complaining about homelessness in their area. There's now a temporary shelter to ensure there's bed space for folks. The city comes, clears out an encampment. Folks have that place to go to temporarily. They're then referred to other shelters, and the majority of folks then end up back on the street and often back in the same area, but months later.
So I guess the question for Edward, for me, as follow-up on this, is that if you folks are having a conversation at the city about a more permanent, another shelter, right? It would be along the lines of IHS, right? That's a temporary shelter, right? If you folks were going to pursue funding something like that, what's your timeline for that? Because I think there's a need for that, right? You yourself said it. We saw the slashing of temporary shelter spaces through the pandemic. And we need to maybe at some point build those up, because that's one place, after Honu, that is the next place that they go to. And then after that, they go to the place that has more, that might be a kahale, or it might be medical, a permanent housing, or 2 to 3 week, or a 6 month. I mean, that's what we're moving them towards. So what is your timeline for looking at that as a potential city solution?
Anton, you want to take that one, Anton?
Yeah. I think that what you're intimating is correct. I think that whether it be another shelter run like a Honu or another shelter that we have in the system, that would be great. When we lost Next Steps, we lost Family Assessment Center, we lost a lot of beds. And like I said, I do believe we need beds of many flavors. I understand that James has favorite type of beds, but I think we need beds of many flavors. And shelter operations can do that. And maybe not, you can look at whether you want it congregate or non-congregate, but I do think we need more shelter space. And then from there, if you have good workers, like you said, Representative, you can move them on to Calhales or other permanent housing. So I would agree with that, whether it be operated like a HONU or operated like a standard shelter. I certainly need, we lost that shelter space and we see it in the numbers.
Okay, but no timeline. I like it that you're agreeing with me, but no timeline yet.
If we thought we had the backing to do that and everybody was in agreement, we could probably, purchase the property and get it up and running in 6 months.
Okay,
I
let me,
think if I can kind of, I mean, one of the things I think the managing director and the mayor kind of have made Anton and I kind of aware of is that the shelter spaces that we lost, I mean, were historically state shelter spaces, yeah? So, I mean, I think for the city to identify a place and try and get it operational, I think Anton's timeline is probably correct, about 6 months. But I mean, again, the mayor and the MD kind of said, hey, Edward, but those are state shelter beds, funded beds before. Can they be the same state-funded shelter beds going forward?
okay, and I
But
guess
we
that's
definitely
where,
do agree with James, that's the ultimate goal, to put them into permanent housing. But I think, there's something about low barrier about being in a shelter as well. I can try it for a day, a week, a month if I don't like it, but I'm not committing to,
And to be clear, I'm not opposed to more shelter space. I'm just saying for the use of the Ohana Zone funds and the resources that are coming through my office, because the mission of my office is to pioneer solutions that are actually going to reduce or end homelessness. There's the homeless programs office, which runs shelter, outreach. It contracts for all the core homeless services. But to me, the intent of the Ohana Zones program was to pilot things that are going to reduce and end homelessness. And so that's where I'm trying to take the resources.
so in our last 2 minutes, and this is where I was going with the question that we were just coming from our House Majority Policy Committee meeting, is that, James, previously I've heard you say that some of the priorities should be just to increase the base funding for homeless programs, and that's fallen out of your 5 priorities.
No, it's part of priority number 4 is to
Okay.
reduce all those barriers from street outreach to housing placement. So
Okay.
that's actually a big part of it.
Can you speak to that? Because I think that is actually, when you talk about previously funded state beds that we've now lost, so that actually means that the state has reduced funding. That's what you're telling us right now. The state has reduced funding because we've cut beds.
my understanding is that I don't think the funding has been reduced, but I don't think it's been increased for over a decade for the homeless programs office core programs, the shelter, the outreach, the case management and housing placement. That budget has not been increased in over a decade. And so naturally it hasn't kept up with inflation. And that's probably the result. That's why resulted in the reduced capacity, number 1. And number 2, it's also strained the frontline staffing of our homeless services system. So that first touch point of someone meeting an outreach worker or a shelter staff, those staff are turning over pretty constantly. They have crazy caseloads, so can't build that trust and relationship with folks. And if you can't build that trust and relationship on the front line, then you can't get someone on the journey that Anton and Edward are talking about, right? That engagement with the system.
I think that is a perfect note for us to end on, because we are going to have another informational briefing on Wednesday at 9 a.m. in the same room and on Zoom. I really want to thank all of you for kind of providing updates on how Ohana Zone funding has been spent, on the progress of the Kauhale. It is very heartening to hear that there has been progress on both Kauhale and the Permanent Supportive Housing Pilot Program we just launched off. There are a number of places where this committee can continue to follow up information on. We didn't even, thank you to the city and county for being here, because of the large amount of funding that does go towards the city and county and the large numbers of people that we're seeing, it was really important to get your perspective. At our next briefing, we hope to get more perspective from the neighbor islands. And this is really leading us into a better discussion for what needs to happen in 2024. So I do want to thank you. I do want to ask you to stay engaged and stay involved, and we will do the same. But on that note, and it is now 4:01, I'm going to conclude and adjourn this meeting, and thank you all for all your good work. We are adjourned.
Thank you.